Welcome to The Check-In, the Image podcast lifting the lid on women's health one honest conversation at a time. I'm your host, Ellie Balfe, and in each episode I sit down with some leading medical minds to explore the realities of our health across every decade. From hormones to heart health, this is your space to feel seen, heard and supported as you take control of your health span. Because when women are informed, we are unstoppable. Today we're taking a journey through women's health from head to toe. I'm joined by GP Dr. Sonja Bobart, who has spent over 20 years looking after women of all ages in her practice D4 Medical in Donnybrook in Dublin. Together we'll move through the body, exploring what to notice, what to test, and how to connect the dots between our physical, emotional and hormonal health. And a huge thank you to the brands that make these conversations possible. Image The Check-In is empowered by Boots, sponsored by Samsung, Waterstone Clinic, Irish Life Health and It's for Women. So Sonja, thank you so much for being here today.
Thanks for having me.
With our body scan that we're going to attempt to do today, let's start with the head, where so many of us live. It feels like lots of women today are experiencing tiredness, burnout, fatigue, brain fog, all of these things. Like, from your perspective, how are women today?
I 100% agree. I think we're putting a lot of stress on ourselves. So there are 4 S's that I'd like to talk about, or even just briefly. So the first S is sleep. Think about how much sleep are you getting? Are you getting restful sleep? The other is sitting. So sitting meaning, are we exercising? Are we taking time to even go out on that walk the dog? Just getting time for yourself just to kind of unwind your mind. The third thing would be something like stress. So are we incorporating too much into our lifestyles? Are we striving for perfection? It's not realistic. We really have to sit back and think, what can we do and not overstretch ourselves? And then the fourth S is social. Are we making time for our families? Are we making time to sit with our friends, talk about different kind of minutiae maybe, yes, but that really does really help us to kind of, unwind from day to day life, really.
Yeah. So women are wound up.
They're wound up.
In a nutshell.
I think they are. I think they're striving for perfection. We're probably doing too much and not taking time just to sit back and reflect.
Yeah, that really resonates. And I think if somebody comes into you, so say a woman comes into you in your practice and they say, I'm overwhelmed, or I'm not feeling myself, or I'm feeling just low. How can you differentiate in a woman, in your patient, between maybe perimenopausal symptoms or lifestyle, or what's going on for women? How can you sort of get it from them, the information that you need to assess?
That's a great question, because that's mainly my job. So I think for a lot of women, it depends on, so we kind of go through a day to day, and I go through diet, I go through lifestyle, and just try to incorporate what are you doing day to day. And it's unbelievable, but some women might be getting maybe 4 to 5 hours and not getting enough sleep. But there's a lot of overlap in terms of perimenopause, menopause and low mood, and trying to differentiate between, is this cyclical or is this accompanied by other somatic symptoms or physical symptoms, such as maybe joint pains, vasomotor symptoms, as in we've all heard about the hot flushes, which is, that kind of levels going up and down. In terms of sleep is a big one that a lot of women tend to find that their sleep is quite shortened, or they're waking at 3 a.m. and they can't get back to sleep. And stressors, as we talked about. So just, ruminating before they go to bed, what, I have to do this, and then I've got to maintain a job.
Yes.
And beyond.
We all do that. I do it myself.
Absolutely. So I think going through lifestyle is super important. That's incorporating exercise, their diet, and then thinking about hormonal and maybe non-hormonal therapies. And non-hormonal therapies are really interesting. So a lot of data is behind things, if we have the time, behind yoga, behind cognitive behavioral therapy. Yeah. All of these really do actually make sense, and they actually do work. And then we think of pharmaceuticals. So pharmaceuticals could be things such as, obviously, HRT that we know about, and non-HRT remedies that, not everyone is going to want to go on HRT, or there could be contraindications to it.
Yes.
And then supplementation. So I always love to do bloods, as most of my patients know. And the reason is, I think we can beside our physical examination, we really can tell so much from blood work, and whether it's your vitamin D levels decreasing, whether it's your folate, these things really do reflect on how we feel on a day-to-day basis. And let's not forget about testosterone, especially in that perimenopausal period. So doing hormonal profiles are really important, but testosterone should always be included as well.
Always, would you think, for most women?
For women over 40, I think it's a good indicator, because I suppose the evidence of testosterone is really libido, but people find on retrospective evidence that if you do add testosterone, it actually might help fatigue, help with muscle, with muscle mass, and help with energy levels. So testosterone can be incorporated. Sometimes it's that missing piece in the puzzle.
Yeah, so interesting. I love the way you approach it. So it sounds like you do a really good lifestyle audit with somebody. And they're sitting in front of you. Because I know that that's an experience that a lot of women have cited, is that they feel often that their symptoms are overlooked or they're not being listened to when they attend their GP. And we all know that there's a time pressure and GPs don't have that much time. And, the reason is totally understandable. But it is becoming quite a female experience to not feel that everything in their life is being taken as one, if you know what I mean.
Yeah.
So I think that's very important. It sounds great the way that you...
And I think there are loads of websites, with regards to menopause and menopausal symptoms. And yes, a lot of things are brought down to menopause, but a lot of symptoms are perimenopausal around the age of 40 plus.
Yes.
So I think don't dismiss hormones.
Absolutely not. But when would antidepressants be appropriate, for example?
I think that the trial is really, if someone is above 40 and they're experiencing a multitude of symptoms that are possibly cyclical, meaning that, say, the first 2 weeks of your cycle, you might be okay. And then roughly kind of going towards your menstruation, you might find that your mood is a little bit lower, or you might get more joint inflammation.
Yes.
That could be perimenopausal. But in terms of low mood probably happens all in terms of depression, isolated. They go hand in hand. But usually if it's an isolated low mood, usually the mood is low in the morning, and then there's a little bit of a boost in the afternoon with circadian rhythm.
Okay.
And if that's more than 1 month with no accompanying symptoms such as joint pains, etc., possibly that is depression. However, it's always worth a trial around the age of 40 plus of HRT, because we know the perimenopausal years are 5 to 7 years before the onset of menopause. And a lot of women probably wait until their periods stop to seek help.
Yes.
And we know the time before that, even psychologically, physically, preventative medicine is those 5 to 7 years beforehand.
Yes, definitely. And so do you feel that HRT is worth a try before antidepressants for pretty much most women? For most women, I think if you trial HRT between 10 to 12 weeks, you're not doing yourself any harm once there's no absolute contraindications, so that be things like clotting, etc., or personal history of breast disease. I think it's worthwhile, because HRT does take about 8 to 10 weeks to start to kick in. So if you give that a good trial and you do notice a difference, happy days. If you notice, okay, I'm 85% there, but not 100%, I think HRT has given its good shot, and continue with it. But if you feel absolutely that's made no difference whatsoever, then I think that's when something like a SSRI or pharmaceuticals would be incorporated. Yeah, that sounds like a really balanced approach. And it was the flip of that for quite a long time, wasn't it? Where women were being over-prescribed. Absolutely. Antidepressants. And that would be and I think exactly as you said there, that GP consultations are 10 to 15 minutes. And so a lot of the time, it could be that not all the symptoms are presented. So I think if you feel that you are perimenopausal or menopause, book a double slot with your GP so that you have time to talk about all your symptoms. Fill out even, signs and symptoms. It's all available online beforehand, so that everything is there, so your GP can go through it, or go to a menopausal unit. Yes, exactly. I think all of these are really important, because it's don't waste time. Do you think there'll be more menopause training for GPs? Is that on the way, or? I think, well, I think I know a friend of mine
said this, we both said this a couple of years ago. A lot of female GPs probably have always done menopause.
Okay.
Maybe male GPs probably did more musculoskeletal medicine.
Right.
So I think if you have a special interest in female healthcare, yes. But was it on our radar kind of 7-8 years ago with the WHI trial that was out, in early 2000s? We definitely met, HRT was poo-pooed, but HRT back then was completely different. It was not 17-beta estradiol or kind of body identical HRT. So I think we've always done it, but now we've more kind of honed in on the niche, if you know what I mean.
Yes.
And I think women are more aware, and the great thing is women are advocating for themselves, saying, I think I'm perimenopausal, I'd like to try HRT. And my kind of solution is, why not?
Yeah,
You're not doing yourself any harm. It actually helps 85% of women. So if you're in that 85%, happy days.
It's wonderful that women are much more empowered now around the topic, isn't it?
Absolutely. And I think women talk. So women, they go out for lunch or whatever and they talk about which HRT they're on. So a lot of the time people come in and they might say, I don't want the patch, I want to be on this. And why, that's great because it's going to suit your lifestyle.
Yeah. It's so true. I mean, even me and my friends were almost consulting with each other about what HRT we're taking. So we're not completely correct. We're not medics, but we are telling one another about how it goes.
Absolutely.
Yeah, it's so helpful.
Yeah.
It genuinely is helpful, that support that we are giving each other in our friend groups.
Yeah. Yeah. But I think women as well forget that they own themselves.
Yeah.
They own themselves, this and their family. Because I think the statistic, I could be a little bit wrong, but 1/3 of women give up their jobs during menopause.
Wow.
Because of, is their workplace menopause friendly? Possibly not. And I think they are, you can incorporate that within big companies. But imagine that people feel they have to give up their jobs during that kind of perimenopause, menopausal phase of their life.
Yes.
Yeah, and that's a time where if women have children, they might have teenage children. Their teenage children could be going through their own hormonal imbalances, so it's a very, very difficult time within a family, I think.
Yeah.
And unless everyone's understanding each other, or supporting each other, because as mothers, we have to support our children during their phase, but who's supporting us?
Yes, absolutely. And I got to say, that's exactly where I am. I have 2 teenage daughters and I'm in perimenopause myself. So it's interesting. Let's talk about other, say, cognitive or neurological areas and looking after our brain health. I think this is a huge area of focus. I feel this is something that women really need to know about in terms of aging.
Yeah.
Particularly, I know that more women than men get dementia. Is that correct?
That's right.
Yeah. I mean, I have first-hand experience of this. My mum has advanced dementia at the moment, and it's just the worst. It is the worst disease. And I'm really tuned into trying to help brain health. But what can we watch out for when it comes to our brain health?
Again, I think it's going back to lifestyle. So looking at our lifestyle, making sure that we're minimizing, say, alcohol, refined sugars, incorporate smoking. So anything that causes kind of an insult to ourselves. The other thing is just so Trinity did a study called the Tilda study. I'm not sure if you know, this is such an interesting study. So basically they followed an Irish population over 20-25 years of what will help them age better. And yes, lifestyle is really important, and actually is probably the most important. Diet, exercise, but social interaction is hugely important.
Yes.
So people that actually, whether you took up knitting, crocheting within a group, took up yoga, or even a new language, that helped that population age less, and therefore those risks of dementia actually were decreased. So social interaction is super important. So families that, I think it's Japan, so there are villages where people live longer. Japan, Mediterranean climates, Japan, because the village looks after you. So there's that social interaction with the village, whereas, we live in Dublin. Do we know our neighbours? Maybe we don't want to. Right. My neighbours are lovely, so I know them. But it's that looking after that community spirit is what in big cities probably aren't there.
Yeah, true.
Whereas places like Japan, the Mediterranean, it's all looking after the elderly, and that actually helps. That's why they live long. That's one of the reasons why they live longer.
Yeah.
But in terms of kind of how do we know if we're, because I know a lot of perimenopausal women and think that they are going demented because they're putting food into the washing machine, etc. But
the brain fog is intense.
The brain fog is intense, and that's your estrogen decline. So things to look out for are basically grooming. So say with your mom, one of the things that starts to show is if your mom had always, say, had your daily shower, put on makeup, etc., has the grooming declined? Have budgeting, so has money gone missing, that they're just giving out money, say, either to neighbours, to workmen, etc. So basically spending that without budgeting, and then being unaware of location. So say you took her to the grocery shop and she didn't realise it was a certain, Super Value or whatever. So unaware of location and time. That's really important. So so I think, dementia is on the rise.
Yes.
And is it because our population is more isolated? Is it because we're living longer? Absolutely. But all of those are all multifactorial.
So all of the community elements
is really important.
Yeah, okay.
Yeah.
And is there something to be said for how we use our brains? So if we learn, if we're taxing our brain or testing our brain by learning, doing crosswords and all of these things that you hear about, or trying to learn a language on Duolingo. That's what I'm doing. I'm trying to learn Spanish on Duolingo because I'm aware that I need to learn again.
Yeah,
because, as somebody, particularly in midlife, you haven't really learned in a long time. So I kind of thought I needed to use my brain that way. Do those things help?
They do. Even doing things out of your comfort zone. Yes, can actually help because we're in that phase of, we're along that train track, but every so often we need to kind of veer off just to kind of re-jog that mind, but re-jog our memory, but also learning different pathways. So learning a new language, learning how to do drive if you haven't driven. So just doing new experiences actually just kind of reinvigorates that mind and reinvigorates yourself. Yeah,
absolutely. It makes sense really when you put it like that. What else might go wrong with the brain? What is there anything else that women should really watch out for? Is there any other symptoms of any other neurological condition?
Well, I think, one of the things that are actually silent are blood pressure. So when people are going to their GP, always get a blood pressure checked. Even your pharmacies will do your blood pressure. So there are three things that are silent that we don't think about as any population. One is blood pressure. Everyone thinks, I'll present with a headache, but blood pressure is silent. So most of the time there's no symptoms whatsoever. The other is sugar. So people wouldn't know that their sugar is high or borderline high unless you get it checked. Again, that's another reason for feeling fatigued. And then the third reason is cholesterol. So again, some high cholesterol has no symptoms. Always make sure that you know those levels. So know your numbers. So anyone over 40, in my opinion, should be getting those levels checked.
And that cholesterol affects not only your heart or your stroke risk, but also the brain, right?
The brain, absolutely. Yeah.
Okay, let's move down. Let's move to the thyroid. We're moving down the neck. So this tiny gland, it controls so much of our metabolism and our mood, right? Yeah. What symptoms would a woman be experiencing if something was awry, something was going wrong?
So women, I suppose the thyroid is located in the neck. So there are two glands in the thyroid, and then you've got a little bridge connecting them. And they produce something called T3 and T4. If those T3 and T4 aren't balanced, then it sends a little signal up to your pituitary gland that produces something called TSH. So that TSH kind of levels the T3 and T4. So that's in a nutshell what how the thyroid in terms of the blood tests work. So if someone presents with, say, an underactive thyroid, they can be feeling fatigued. They might think, oh gosh, my bowel motions are a little bit different than they were before. Constipation. They might have weight gain. So they might have unexpected weight gain, although their lifestyle hasn't changed whatsoever. They might also complain of maybe their hair, the skin, their nails are a little bit dry. And sometimes they can present with palpitations. So that, or the other thing that's quite interesting, and I know we're going to touch on this, is maybe someone had a fracture for a non-traumatic fracture. So thyroid disease or any malabsorption can cause osteoporosis. So thyroid is an indicator for that. So those would be reasons to kind of suspect possibly that a thyroid issue is going on. as well as obviously family history. So if someone has a family history of thyroid, it's more common in women actually around the menopausal age.
Okay.
So thyroid is always one of those baseline tests that we should all be getting checked as well.
Right, okay. And women probably are not getting it checked, are they?
Hopefully they probably aren't actually. Yeah, but it is an important one to get, because I know, like, say, going back to, say, fertility, most women that are, say, if someone was trying to conceive, they should always be getting a thyroid test done, because an underactive thyroid is one of the reasons for kind of prolonged conceiving. So definitely they would be done unexplained. So there's something called anemia of chronic disease. So if someone has an anemia, meaning like a low iron for no reason, thyroid could be one issue as well. So there's so many different ways that thyroid can present, but the common pathways would be the constipation, the dry skin, the fatigue, the weight gain, and possibly palpitations.
Yeah, okay. And so what are the simple, like, what would you advise women in how to look after their thyroid? Is there a way to bring it into balance with lifestyle, or is that not, can you not affect it with lifestyle only?
I think, well, certain things can affect the hormones. So certain, like, stressors. So, you know, if you're stressed, the cortisol goes up, and then your TSH so that thyroid stimulating hormone blood test, that can go up as well. If someone is on medication, that can affect your thyroid gland in terms of the blood tests, not the thyroid itself. And just maintaining in terms of lifestyle, again, your stressors, you're not sitting down, you're you know, that actually does help your thyroid.
And your general health. Okay. Let's move down to heart, lungs, chest, breast, this area. Heart attack is often under-recognised in women, I believe.
Yes. So the presentation of heart attacks in women are completely different than, you know, everyone thinks of clutching on the chest, falling down.
Yes.
Of the general chest pain radiating down to the left arm. For women, it can present so differently. So it can present with back pain, jaw pain. It can present with just even shortness of breath. So shortness of breath, even going up light stairs, waking up with indigestion. So it can present in so many different ways in women. But for women, they might not think about heart. A lot of women absolutely think about breast disease. But women are 6 times more likely to die from heart disease or contributing factors than of breast disease.
And breast cancer.
Yeah. So obviously we have to all check that, monthly. But in terms of your heart, think about those silent things we were talking about in terms of your blood pressure, making sure your cholesterol is down, and making sure your exercise is good, and your blood sugar, because we're protected with estrogen until we're perimenopausal. So there was another interesting study done in the States, actually, of people that had the gene for Alzheimer's.
Okay.
So that gene with Alzheimer's, it was compared to perimenopausal women and their vasculature, so meaning their vessels, so that women that were perimenopausal had more plaque deposition in their brain and their arteries than people with a predisposition to Alzheimer's. So that's the importance of, yes, we know HRT helps, but that sudden drop in estrogen is making us more at risk of vascular disease or vascular compromise, which is heart disease, stroke, peripheral vascular disease. So making sure that, you know, we're looking after.
So what happens post-menopausally then? So once estrogen has disappeared,
yes.
we do. I mean, can we stay on HRT for a long period of time?
Absolutely. And I think the studies show that if you stay on HRT for a considerable length of time, but it depends on the dose. So you should stay on the minimum amount of HRT that's effective for you. But remember, HRT also, although that helps your cholesterol, it also helps your bone density, helps, and new studies have shown now that it helps prevent against dementia. So I think if you've got compounding risk factors in terms of breast disease, so people forget breast disease is only 5% genetic. The majority is not genetic. So keep checking your breasts every single month.
Yes.
If you're menopausal and not bleeding, make sure it's the first Sunday of each month, or pick a certain time, and making sure that you're up to date with your mammograms and that you attend your screening.
Yes.
Because only 75% of the Irish population attend screening.
75%. Okay. I thought women would be a little bit more proactive around that.
And I know Breast Check are doing their best. But if you feel, if you feel a lump, if you feel anything whatsoever, get doubly checked. But most women find their own breast lump.
Yes.
And make an appointment with your GP. And most breast lumps are not cancerous.
Yes.
Only 1 or 2 out of 10 are, but making sure that you're getting your up-to-date mammograms or ultrasounds, whatever you need.
Yeah. Do you see women in your practice who they understand what they're checking for and when and how to do it?
Yeah.
Do you see it's getting better and
It's getting so much better. But I know Breast Cancer Ireland did a study and only 1 out of 4 women check their breasts regularly. So that's only 25% of the population.
Really?
And
that's so low.
And it's less in younger age groups. So women under 35 are less likely to check their breasts than women over 35.
Right, okay.
So just kind of getting that message out that from the age of 20, we need to be checking every single month, and men too.
Mm-hmm. It's something we need to talk to our young daughters about.
And show them how to do it.
Teens, right? It should be something that just becomes regular.
And even in their TY program.
Yeah.
I would love to go into schools and teach how to check your breast, because unless your mum shows you, how are you going to know?
Yes, exactly.
Do you know? Or your grandmum.
That sounds like a great idea. Please do that. That's wonderful. So in terms of our lungs then, Sonja, so let's take smoking. People are smoking less, but it looks like they're vaping lots more. What's going on there? What are you seeing there?
There's loads of vaping.
Yeah.
I think people vape socially, and because you can do it inside or outside. But vaping is us heating up a substance. That substance becomes an aerosol. We're inhaling that aerosol into our lungs, and that's causing inflammation and irritation. So it's really important that we teach our younger, children all about vaping from the age of 10. I think people are buying vapes.
They are.
And obviously, I know, people think, okay, it's not going to get into my hair, it's not going to smell, but the repercussions of vaping is unbelievable. It's more addictive, more irritating, more inflaming. Popcorn lung has been described, which is...
What is that?
Popcorn lung basically are changes within the lung that was seen in popcorn factories.
Okay.
So I think the butter that they use in popcorn gives off a chemical that once that's inhaled, it actually changes the structural formation within the lung.
Oh, wow.
And so it's kind of like it's called a bronchiolitis. So it's basically an inflamed lung. So that's what it's doing to us.
Yeah.
Apart from that, people think about the lungs, but what about the mouth down to the throat pipe?
Yes.
Down to the lungs. So all of that is going to get inflamed, irritated, but also you're opening up your taste buds, these substances that are aromatic. So definitely that's going to, at some stage, going to be linked to kind of oral pharyngeal cancers.
Yeah, for sure. Wow. Okay.
And aging.
Yes, exactly. And so many young people are vaping so much, aren't they?
So much.
It's slightly terrifying. Okay, let's move down to another area. The gut. Now, so Image did a survey for the Image Women's Health Clinic, and it was the highest area of interest for Irish women. So several thousand women responded to the survey, and this was where they felt they needed the most guidance and attention, actually, which I thought was very, very interesting. So the gut is the second brain, we are told, and it's connected to mood, immunity, hormones, everything. Like, talk us through that, the power of the gut and the influence of the gut.
The gut. So the gut is basically the gum to the bum. So what that means is from the mouth down to your bum. And within that colon, there's our microbiome. So the microbiome is our second brain. And the reason for that, it controls so much. So 80% of our immune system is in our colon. The largest endocrine organ is the gut. So your endocrine are your hormones. So, and then your digestion. So what we eat is digested goes through the stomach, goes into the colon, and that is kind of absorbed. If you're eating, say, a lot of refined sugars and that's causing a bit of dysbiosis, that's causing kind of a leaky gut, Therefore, you can't get those lovely short chain fatty acids that are going to help your cholesterol, going to help your absorption of your B vitamins. And then lastly, your nervous system. So the brain, so the microbiome controls your nervous system. So say you've got your fight or flight, so you're scared, you know, your sympathetic parasympathetic system is going on overdrive.
Yeah.
Therefore, you secrete cortisol, and your cortisol levels therefore are making you anxious even more. So if these are in complete disarray, or as we mentioned, dysbiosis, then there's no equilibrium between our brain and our gut, and therefore that can cascade into so many different other factors as well.
What does dysbiosis mean exactly?
Yeah, so dysbiosis basically is that kind of difference between, it's basically not equilibrium of your gut. So you get possibly more bad bacteria than good bacteria, and that's the basis behind things like your Mediterranean diet or rainbow diet, your Japanese food, because they all incorporate loads of different types of vegetables. Vegetables are great. Complex fibers are great, because complex fibers, everyone thinks it's cardboard, but actually complex fibers are just oligopolysaccharides. So they're just sugars. So sugars that can't be broken down until they get to the gut. And when they're broken down into those small chain fatty acids, the one particular one is called butyrate, and that butyrate is really quite effective in terms of creating that kind of barrier of the gut. Therefore, you don't get the leakiness of good and bad bacteria within that gut. So it's kind of like your little fence within your colon,
boundary.
Your little boundary, absolutely. So that helps. Whereas dysbiosis can present in so many different ways, and one of them being irritable bowel. So irritable bowel, so 10 to 15% of the population will suffer from irritable bowel, and for some reason it's more likely in women than men.
And why could that be?
I don't know whether it's an estrogen related thing, possibly, so it could be a hormonal. The other thing, I think women possibly are more in tune with their physical health, possibly, than men, possibly. I'm not sure.
So it might be underdiagnosed in men.
I think it's possibly underdiagnosed in men. But also, I think within men, they probably have that work-life balance to some degree versus women. And but with women, it can present with bloating, a change in your bowel habits, but accompanied by no weight loss, no blood within the bowel motions, but it's kind of relapsing and remitting. Those symptoms are. So irritable bowel is very common, but I always say to people, it's really important to make sure nothing else is going on. So make sure, obviously, you're getting your bloods, make sure it's nothing to do with the ovary, make sure it's not fibroids. So irritable bowel should always be diagnosed when everything else has been investigated. If that makes sense.
Yes. And so what about Crohn's disease then? How does that present?
Yeah, so Crohn's can present with bloody diarrhea. It's a malabsorption problem. So several bowel motions throughout a day, potentially bloody, but Crohn's affects from the gum to the bum. So you get ulcerations all around the gastrointestinal tract. But also can present with something like a low B12 or a low folate or a low serum iron because of that malabsorption as well.
Yeah.
But that bloody diarrhea. So Crohn's has to be investigated. However, 40% of people with inflammatory bowel disease will also have irritable bowel disease because of that gut microbiome as well.
Sure, okay.
But in malabsorption diseases, it's important not to just take any probiotic, that they have to be kind of investigated first.
Okay.
Because potentially taking any probiotic can exacerbate the Crohn's or ulcerative colitis.
Really?
Gosh.
Do people know that, I wonder? This episode of Image the Check-In is empowered by Boots. Boots pharmacists are with you for life. They are often the very first stop when it comes to advice, care and guidance. For all facets of women's health, from every age and every stage, Boots is here to help you feel informed, supported and empowered every step of the way. We are proud to partner with them to bring you the knowledge you need to future-proof your health. So in terms of diagnosing IBS and Crohn's or any of these conditions, are they just done via the symptoms, or is there a blood test, or like what? When somebody comes into you and says, I think I have these symptoms, what way are you diagnosing them?
I always do blood tests, but there's also inflammatory markers you could do for Crohn's. So that's your ESR, CRP, and if there's anemia or if there's malabsorption, so that should be B12, folate, and ferritin being low. With someone who is IBS, usually they don't have nighttime symptoms, so they can present with, bloating, relapsing and remitting, abdominal discomfort, loose bowels, but usually, and no blood. And usually that doesn't happen at night. And so they might have it 1 week, 1 day a week. There is a criteria called Rome criteria. It's only used for, I think, just for investigations, really.
Yeah.
So I shouldn't even say that. But it's basically relapsing and remitting 1 day a week per month. And so that's how you diagnose irritable bowel. But I think anyone over 40 that's presenting with new onset bowel symptoms,
Right.
over 35 presenting with new bowel symptoms, has to be investigated. You can't just assume that it's irritable bowel.
It feels like it's become a bit of a catch-all term. A lot of people almost self-diagnose or say that they have IBS, don't they?
Yes.
But it may not actually be.
IBS.
So it's so important to get the tests.
Yeah, because of the other thing, and it's not to scare anybody, but that could be ovarian pathology. So it could be an ovarian cyst, an ovarian diseased ovary. So, with presenting with bloating, change in bowel habit. So that's really important, just to make sure anyone over 35, don't assume you've got irritable bowel.
Yes, exactly. And speaking of the bowel, then what about bowel cancer? Like, what should we be looking for there? Yeah. There does seem to be more awareness now about the symptoms of bowel cancer. And bleeding and a change. What are the big watch outs?
Any change in your bowel habit whatsoever. So any change over 1 month, any weight loss. So weight loss, any blood that's coming through that back passage needs to be investigated. Don't assume it's hemorrhoids, which a lot of people do.
Right.
Painless bowel motion. So if you've got bloody stools and they're painless, that has to be investigated. And then, of course, then we do bloods. So any discrepancy in your bloods, and I know we're going to talk about this. So looking at bloods over trend. So say someone had their bloods done a year ago and their serum iron was 25, which is absolutely fine. And then all of a sudden it goes down to 10. That has to be assumed that if there's no dietary change, if nothing in their lifestyle has changed, that's coming from the bowel. There's bleeding somewhere.
Right.
So that, again, a colonoscopy and a scope test needs to be done.
Yeah.
So we look into the tummy and look into the bowels. Weight loss, blood rectally, that's painless. Investigation. What are mucus or pus?
Oh, okay. And what are bowel cancer rates in Ireland like?
So screening at this time is 60 plus. It has to be brought back to 50 at least.
So screening for bowel cancer needs to be dropped to a lower age?
Definitely, because bowel screening starts at 60 in Ireland. And I think they're in the last 6 months, they've changed that to 59.
Okay.
But it has to be 50 really.
Right.
At least 50. So if someone has a polyp, if someone wants to get a scope test done, they should, and if they have a family history, they should be getting scopes. Especially the fact that if you have polyps over 10 years, they can change, and that's a risk factor for bowel cancer. So get your scope test done from the age of 45.
Okay.
If you can.
Yeah, okay. Going back to the gut and general gut health, what are the main principles in terms of diet, in terms of nutrition? Fiber. It's not cardboard. So diversity of your diet. So in terms of a healthy gut microbiome, fiber is brilliant because we know it's going to help your cholesterol, it's going to help your oligosaccharides, etc. But the other thing is making sure you've got loads of different, rainbows throughout the week of your on your plate. Yeah, 30 plants. Is that's something you see around? Is that
absolutely
true?
Nuts and seeds. So whole grains, because again, they're affording a different type of microbiome, to you. Another very interesting study, and I promise you this is interesting. There's an amazing scientist called John Crine in Cork. I don't know if you heard of him. So over the last number of years, what they did, they took rats and put them into a completely sterile environment.
Okay.
So nothing, whatsoever. So they all reared in a sterile environment. And those rats had a lot of behavioral problems, a lot of stressors. But once they introduced, diversity into their diet in terms of they actually had feces, because that's where you get the probiotics from. So they did that to a certain subsection of those rats. Their behavioral problems and their stressors actually diminished.
Oh.
So it's really interesting, right?
Yeah.
So that's how the thing about gut microbiome. Oh, so they're not doing, so that obviously that's done on stressors and behavioral problems. So using having probiotics, having a probiotic diet, whether it's supplementation, it should be all of the above. On, say, children with ADHD, that's proving to be positive, as well as your autoimmune system. So things like Parkinsonism, rheumatoid arthritis, things like your inflammatory bowel disease, under examination. So those actually are quite positive. So then the other thing that John Crown's doing is also with aging. So as possibly with your mom, I know with my own parents-in-law, as they aged, their diet was not as diverse as we try and make ours. So, like there might just be toast and an egg and mightn't eat till dinner time. Always the same. So diversifying that diet is so important for their gut microbiome, and actually it helps them in terms of their gut health, but also in terms of their aging as well.
Yes, absolutely, because everything is connected. In terms of probiotics, actually, it's difficult as a regular person walking into a shop to know what to buy. Do you have any guidelines on what type of probiotic to choose?
Well, I think, we're inundated with probiotics, right? Yeah. So the thing is, look for a probiotic that has loads of diversity. So whether it's Lactobacillus bifidobacterium, and then you want to also make sure that when it's going into the gut, it's actually going to be live. So you're going to lose probiotics as you take them through the gut so it needs to be a huge percentage of probiotics when you're actually taking them in supplements.
Okay. And a few different strains, or is it okay to have one or two?
It's probably best to have a few different strains, but the percentage of their is called CFU should be high, right? Because you're going to lose a bit of them. You're also diversifying them, I believe, every 3 months, because then it's like being on the same antibiotic all the time. Eventually it's not going to work. So I think every 3 months kind of mix it up a bit. Because
your body will become used to it. It's less effective.
Yeah. And that goes with your diversity of diet.
Yes, okay.
Make food interesting.
Yeah, exactly. That's very interesting. Let's move on to our pelvic health.
Yeah.
And I think this is an area where there's still so much silence around this for women, not around everything, but our gynecological, our urogenital, our intimate health, our sexual health, all of this. There's known conditions that people are much more aware of and happy to speak about, but it still feels like there's a lot of embarrassment around it. Would you see that in women coming to you?
Yeah. And that's such a good point, Ellie, because I think women don't talk about urinary tract infections. They don't talk about feeling like sandpaper during intimacy. And a lot of women, the way I kind of approach it is, do you have to buy lubricant in order to be intimate? And if they do, that there are products out there that are really going to help them. Yeah. And that woman coming in every month or probably maybe more frequently with urinary tract infections, they mightn't know it's because they've got genitourinary syndrome. So it's really important that we talk to our friends about it. We talk to our in-law, our parents. Yeah. Because even older women that do come in, even in a nursing home, they get urinary tract infections.
Yes, a lot.
A lot. Yes. And that can lead to a lot of morbidity. So it should be talked about more. And I mean, thank God there are social media pharmacists out there who talk about it a lot, and I think it's so important because it's normalizing it, which is what we need to do. We shouldn't be embarrassed about having to say yes, it's uncomfortable.
Absolutely, yeah. And it's important how we raise our daughters as well, and our sons, I think, which is having these conversations really openly at home or in the family about how a female body works.
Exactly.
I mean, it's just so important, isn't it?
And also, I think urinary tract infections are probably one of the commonest reasons why people come in perimenopausally. So those few years, those 5 to 7 years we were talking about before menopause, some of the first signs just could be a change in that pH.
Yes.
So recurrent urinary tract infections could be from the age of 40. So it's just something to be aware of for women, because the remedy is so simple.
Yes. It's just understanding and seeing the connectivity of it all, isn't it?
Yeah.
So what it's related to, you're having a UTI, what's the reason? Like just bringing it all the way through the line to really understand it.
Yeah.
Sonja, is it true that endometriosis is on the rise?
Endometriosis is on the rise.
Why?
And I think, again, there's a lot, definitely lifestyle is incorporated where, in terms of our diet, inflammatory diet, probiotics are definitely one way that can actually help endometriosis. So having a non-inflammatory diet, whole grains, etc. And I think people are more aware of it. And I think years ago, women might have thought, oh yeah, it's my period, I have pain, I'm missing a few days off school, and that was normalized. And it's not normal.
No.
It shouldn't be normalized. So yeah, it definitely is on the rise.
Okay. And what about PCOS?
Yeah, polycystic ovaries is 1 in 4 women have polycystic ovaries.
1 in 4.
And I think, again, it comes as a triad. So it's 2 out of 3 criteria. So one of those could be people might assume, oh, but I'm not hirsute, so I don't have loads of hair on my face.
Yeah.
I don't really suffer from acne. So you only have to have 2 out of those 3 criteria.
Right, okay.
In order
so
to
what
be
are
diagnosed.
What's the full criteria?
So your period is not regular, so it's called oligomenorrhea. So sometimes people get maybe 4 periods out of 12 months. So they don't have a regular cycle. The second is acne. So sometimes people might be put on,
Roaccutane or something.
At the age of 15, but not been investigated. Why do they have bad acne? And the third thing is hirsutism. And other things go with that, as in weight gain, metabolic syndrome, or kind of like down the line. So 2 out of 3 of those is polycystic ovaries. So it's incredibly common, very treatable. It's, so treatable. And people always think about fertility problems with polycystic ovaries, but it's a spectrum. So you can have mild, moderate, severe. So don't lose faith if you've been diagnosed with polycystic ovaries. It's very, very treatable.
Is it treatable to resolution? Or
it's treatable in terms of if you stop ovulation or if you control insulin levels over a period of time, that helps the hormonal imbalance. So in terms of blood tests, it's an FSH-LH ratio. So it's your follicular stimulating hormone versus the luteinizing hormone. So that's not a 1-to-1 ratio, day 2 to day 5 of your cycle. So if you put someone, say, on something that's going to stop ovulation, so that would be something like the oral contraceptive pill, or something like glucophage or metformin, which is to control insulin levels, that will actually help that kind of hormonal imbalance. So you don't have to be on a contraceptive pill. Glucophage will glucophage is an amazing medication because it'll actually help skin and also help control the insulin. Therefore, that's going to help control the hormone.
Okay, so there's several routes.
Yeah.
Wow, okay. Yeah. That's good to know. And then when we have babies, thinking of postpartum women. So I was reading recently about that French women basically receive 10 to 12 complimentary women's health physio sessions in order to help their pelvic floor after giving birth. And we don't have that.
No.
At all. Do you feel that women really, do women know about this now? Do they know the importance of the pelvic floor? What's happening there?
I think it's starting to be highlighted. And I think not until women are, say, in their 40s, that I think a lot of the time people think, okay, that's just because I had a vaginal delivery.
Yes.
Whether they're leaking or whether they're having stress or urge incontinence.
Yes.
So you're exactly right. It should be incorporated that, say, they get even 6 sessions with their pelvic floor, but making sure every time a woman comes in, they're getting their blood pressure checked. And are you doing your Kegels?
Yeah.
Because that's so important.
Yeah.
Because as we know, as we age, our vaginal health decrease, the pH decreases, but also because estrogen is in that area, and as estrogen falls, so does our pelvic floor. So we've got to, as soon as we can, we have to just keep our pelvic floor going, doing your Kegel 60 times a day will be important. So every time you wash your hands or stop at a traffic light, try and do 10 Kegels.
Yeah. Okay. There's lots of people on Instagram now who are just doing these, like, Kegel reminders, which is really, really good.
Oh, brilliant.
But I still think it's an area where there's a bit of embarrassment. And when you're speaking about continence or leaking or anything like that, I do have a personal experience of this because this summer recently, I had a double prolapse surgery. So because my pelvic floor was so bad after having my two daughters, and I had no idea. So my eldest daughter is 16, my youngest is 14, and it was just in the summer just gone, whereby I had to have the surgery. And I noticed leaking, all of these things. They were the symptoms that started. Yeah. But it took that long for the whole thing to actually become obvious to me. And I was not doing my Kegels. Yes. I took the leaflets back in the day. Yeah. It was on my mind that I should do it every so often. And then it turns out I was doing them completely wrong anyway, because I'm now seeing a physio as part of the rehab. Yeah. But it struck me as this entire area of, my health, and I knew nothing about it until it happened to me. And the same thing when I was talking to my friends. People were like, what? Prolapse? What has prolapsed? And it was my bladder and my bowel. Wow. And I just thought, this is such a huge area. And it was from the labour of my two girls.
The two girls.
Yeah, so long ago. Wow. But it's just, women just need to know about this so much more.
I think you're right. It's not talked about, but hopefully now it will be. And then reminding, as you said, through social media, reminding people to just do their pelvic floor exercises, or even have one session with the pelvic physio to make sure that you are doing it correctly.
Exactly.
But I think it is, that's what we owe ourselves, right?
Yes. Yeah. Do you think we'll get to that in Ireland? Do you think the HSE will?
That would be a good campaign, right?
Something we need to lobby for a little bit, I think. Can you touched on it there when you were talking about UTIs a while ago, vaginal estrogen.
Yeah, wonder product.
Yes, right? Yeah. So this is something that I hear that we should be on until the day we die type of thing. Yes. But that directly helps with UTIs as we age. Yeah. And what else? Sexual health.
So it helps to control the pH. So remember, estrogen is not only around us, it's also in the bladder, in the urethra where we pass water from. It's in the uterus, obviously, and so it's all around the gynecological area. So if someone's had a surgical menopause or they're going through menopause, they will no doubt have genital urinary syndrome. So genital urinary syndrome can present in so many different ways. So a lot of time people might come in and they might say, I'm a bit uncomfortable vaginally, or I think I have thrush because I'm itchy. Always make sure you're checked, so it's not that it's not thrush, it's not another thing called lichen sclerosis, which is a different remedy, very treatable, but a different remedy. But vaginal estrogen basically gives you localized estrogen. There's less systemic effects. So what that means, it doesn't absorb throughout your system. So a woman that has had a personal history of breast disease, all the data have shown that if you use vaginal estrogen, once you've finished treatment, your 5 years, you can actually go on it without it causing any repercussions to that breast. And that was a study done, a worldwide study, which actually, because a lot of women that have had breast cancer, that is a number one symptom. They're just unbelievably uncomfortable down below. Okay. So it restores that vaginal epithelium. So what that means, it restores that kind of moistness, bulkiness of that skin. So instead of that skin being dry like sandpaper, it's actually going to re-epithelialize it. So it's going to just make it the way it had been when we were in our 30s. So there's so many different reasons. And one of the other reason is it controls pH. So if you're going to control pH, you're less likely to get things like thrush, bacterial vaginosis, and urinary tract infections. Yeah, okay. But remember, if you're on systemic HRT, so if you're on the patch, the gel, the spray, that's not going to help vaginal health. And if you're on something like Vagifem, Blicel, or Uvestin, that's not going to help systemically. So most women need both. Okay. So I think the statistic is about 90% of women over 45 are on some form of localized vaginal estrogen.
For as long as we live.
As long as we live.
Okay.
It should be in our Christmas stocking.
Yes, exactly. Good to know. So, Sonja, our bones and skin also tell a lot of our health story. back to us. When should we start screening for bone density? We hear a lot about this. I mean, can we just request a DEXA scan? What should we be doing?
Yeah, there's no national screening for bone density in Ireland. However, if you've got risk factors, so risk factors would be things like if you haven't had a period over 6 months when you're a teenager, if you'd suffered from disordered eating as a teenager, those are risk factors. Things like malabsorption, so celiac, Crohn's disease, ulcerative colitis, thyroid disease. So those are some of the kind of medical reasons why you should get a bone density. Any non-traumatic fracture has an increased risk of having a low bone density or even a low bone mass. So if your bone mass had been quite low, that's another risk factor. So anyone over, if you've a family history of osteoporosis, osteopenia, that's another reason. And then going on to, if you're over 45, everyone should get a bone density done. The reason being is preventative health.
Okay.
So we're not waiting to have a fracture. It's every 3 to 5 years, depending on that initial DEXA scan.
Okay.
So and you remember HRT is treatment and prevention for osteoporosis, making sure that we're doing our weighted exercises. I think jumping jacks, yoga are great exercises to do. Making sure that your vitamin D intake usually has to be supplemental. Your magnesium can be in your seeds, your oils, your whole grains, and your calcium. So dietary calcium is really important. So your slice of cheese, your yogurt, which also has your probiotics, are all really important for your bone health.
Okay. And speaking of jumping jacks, actually, I was reading recently that impact of jumping is really good for our bones, isn't it?
Yeah, yeah.
So we have to walk, but if we need that impact of jumping or hitting off something.
Like even a trampoline.
Yeah.
Have fun on the trampoline.
Yeah, okay. Yeah. What about joints? How can we protect the joints as we age?
Joints, joints are an interesting one because people that tend to exercise a lot sometimes do have joint inflammation. But the other thing is supplements help. So making sure you're doing your oily fish. So smash, I love this mnemonic. So it's smash sardines, mackerel, anchovies, herring, and sorry, I have to do that again. Sardines, mackerel, anchovies, SMAS, salmon, and H herring. Okay. So those are your oily fish. Those are your omegas. We should be having 3 portions a week, and that helps your joints. If you absolutely find them all disgusting, walnuts are a great source of omegas as well. If not, supplements. So we can't process omega-3s. So 1,000 milligrams of omega-3s are really important for our joints, our mental health, our brain health, our heart health, because it helps to decrease triglycerides. So omegas are really important as well.
Should we be taking those throughout our lives, like from a young woman all the way to...
I think it depends on diet.
Okay.
So I think it's an important one to actually take.
Okay. Let's talk quickly about what I call the triple S, sleep, supplements and stress. You've touched on some of it, but it's sounding like these are really the 3 levers that you can pull to have a healthy life, right? So sleep, 7 to 9 hours?
7 to 9 hours.
Okay. If we're waking at 3 a.m, what's going on?
3 a.m. is our perimenopausal woman or man. So what happens is you basically, with circadian rhythm, you get an increase of cortisol. So your kind of deep sleep going into your light sleep happens around 3 a.m. in the morning. That's one reason. So cortisol levels are increasing at that stage because we're like, okay, we need to get up and face the day. The next reason is progesterone. So progesterone falls during perimenopause. So those levels are usually decreased around that time in the morning. So that's another reason why we might be getting up at 3 in the morning. So when people are on HRT, sometimes there's a medication called eutrogestrone that they use at night, and that actually really helps their sleep as well without having to go down any sleeping tablet route.
Sleep aids,
Your sleep cycle changes. So sleeping 7 to 9 hours is important because of a load of cascades of reasons. So in terms of your memory function and hormonal control, so it secretes these 2 neurotransmitters called ghrelin and lutein, and they help our satiety. So they help our feeling full or hungry. So if our sleep is disordered, what happens is that they aren't secreted. So therefore, that's more likely that we're going to gain weight. It also is a restful time for us. So you're kind of resting your cortisol. So you're giving your body time for the cortisols to go down. So if your sleep isn't working well, our cortisol is going to be up when we're awake, and therefore we're going to feel more stressed. Also, in terms of immune response, so people that don't sleep well have an increased risk of inflammation and infection. So those are loads of reasons why we really should try and get our sleep in check, because then it just makes the next day and everyone's lives so much easier.
Yes, impacts everything.
But stressors can also, so I think, when people wake at 3 a.m, I know myself, I'm reinventing the wheel of all these amazing ideas, and then I can't remember them at 6 a.m. But kind of writing down before you go to bed is really important. So journaling, I think, is undervalued. I think writing 3 things that could be worrying you, 3 things that were amazing during the day is really important. Just because you've written them down, and then you can close that book and pack it away.
Yes. Making
sure that you're kind of getting that routine of sleep in. So going to bed at 10:30 at night, waking up at 6 a.m, whatever suits you is really important. So and never looking at the clock if you wake at 3 a.m. Don't look at that clock. Just try and do your yogic breathing to get back in. Don't pick up the phone or the iPad. Just go back to that yogic breathing, and that should hopefully just settle you back down to sleep.
And supplements, what would you say are the top 3 for women for general health? Omega-3, you've already said.
Omega-3, vitamin D, and folate.
Okay.
So folate is an interesting one. Folate
iron, right?
Not everyone needs iron.
Okay.
Sorry. So folate is your vitamin B9. 60% of the population can't process folate. So you could have all the dark green leafy vegetables that you want, but you're not going to absorb it in. So folate is a supplement that has so many positive benefits, that including it helps your helps with heart disease, helps with your health in terms of mental function, helps with mood, helps with energy. So sometimes you could be doing all these bloods on someone and their folate could be 4 or 3, which is quite low. And just even replacing folate just helps their fatigue.
Okay.
So folate is a really important one that I think the majority of patients that we see, their folate would be below 10. It'd be quite low.
Right. And what's ideal?
Anything above 10.
Anything above 10.
Yeah.
Okay.
I know certain medications can interact with this, like methotrexate, etc. So get your folate checked.
Okay. Interesting. That's one you don't hear about so much.
Yeah. Vitamin B9.
Yeah. Okay. And what about stress? Top tip for stress or beating stress? I mean, it's a wide topic, clearly, but...
I think look at your lifestyle. So look at what you're doing day to day, write things down. I think journaling is really important because we forget how good our day is. And human nature is we focus on the bad. So I think most people have 3 good things in their day.
Yeah.
So I think that's really important to do.
Yeah.
And then those kind of 3 bad things that happened, you've written it down, close the book, move on.
Accentuate the positive, right?
Accentuate the positive, absolutely.
So before we close, Sonja, what way can women be more proactive with testing and tracking their general health? So in terms of blood tests, in some other countries, they have the annual health check where they get blood tests, they get stool samples, they get lots of screenings. I think that happens in Germany. But what can women come to you or come into their GP and ask for each year to keep track of their general health?
I love that question. The reason is that we should all be doing this. So from age 35 to 40, we should be getting annual blood tests, annual breast exam. In Ireland, screening for cervical disease is every 5 years, 3 to 5 years, depending on your age or depending on the previous history. So getting all of that checked is really important. Making sure you're getting your blood pressure checked, your heart checked, lungs, stomach. Just it takes 2 minutes for someone to put a hand on your tummy. Urine. So people forget that a urine test can reveal so much. So doing an early morning sample urine when you're not menstruating, obviously, is really important because it can tell your protein count. You can tell if the red cells are there that should not be there, and then onto your blood test. So making sure you're getting a huge full biochemistry done. So that would include your kidneys, your liver, your cholesterol. So cholesterol is your good and bad cholesterol, and your triglycerides. Making sure you get an iron screening, as you're saying. So that includes your B12, your folate, your ferritin, and your serum iron. thyroid function is really important. Your vitamin D and your vitamin B12, and in some hospitals you have to actually specify that. Calcium and magnesium are really important. And then if you've got any family history after that, in terms of thyroid disease, you should get your thyroid antibodies checked. Hormonal profile between day 2 to day 5 are important. If you've got any kind of symptoms of perimenopause, polycystic ovaries, they're important as well. And then if someone has a family history of something like rheumatoid arthritis, psoriasis, anything autoimmune, that get an ANA screen. And lastly, celiac. Because celiac disease is very common in Ireland. You mightn't present with anything at all, but it's an important diagnosis to make.
Oh, wow. That sounds like the ultimate check-in. I love it. Sonja, thank you for guiding us through our little body scan today. It's really, I love how you've reminded us that everything is just so connected. And that's the way to view our general health, isn't it? But lastly, just before we go, I'd love to give you the last word. What gives you hope for women's health?
Oh, I think we are so lucky to be living in Ireland. I think, healthcare, I know a lot of people think might not be 100%, but I honestly think we're getting there. Think of the way we were 5 years ago, where I know myself, I missed perimenopause in my own patients. We're all caught up with COVID. I think we're able to speak up for ourselves. We're able to advocate for ourselves. We've got free screening for cervical disease, for breast disease, and we've got bowel screening, which I know has to be brought back. But healthcare is amazing in this country, and people should use it. Use your breast screening. Go for your mammograms. Go for your cervical smears. And the other thing that people forget is advocate for yourself.
Yes.
If you're not feeling well, go in, and you shouldn't be waiting weeks for your GP. Your GP should be seeing you within a couple of days, which in most clinics they are.
Yeah. So help is out there.
Help is out there.
And things are looking up.
And when in doubt, check it out.
Yes. I love it. Thank you so much for your time today. It's been a wonderful conversation.
Oh, thanks so much, Ellie.
Thank you for checking in with us today. We hope this episode gave you clarity and insight. Don't forget to like, subscribe and share it with a woman you feel needs to hear it. Image the Check-In is empowered by Boots, sponsored by Samsung, Waterstone Clinic, Irish Life Health and It's for Women.